Greetings. I'm Ken Kozel, President and CEO of University of Maryland Shore Regional Health, here to offer you this week's update on how our healthcare system is responding to COVID-19. As you may know, we've worked diligently to plan for surge by doubling our inpatient capacity and quadrupling our ICU capacity. While I'm pleased to report we have not approached these levels, we continue to aggressively manage this pandemic and have been able to accommodate all patients within our normal bed capacity. During the early stages of planning for our surge, the general expectation among hospital leaders nationwide was that we would experience a steady climb in cases that would eventually reach a peak, and then a descent from that peak as social distancing and other strategies succeeded in reducing the rate of infection in our communities. This expectation was modified to not include a peak per se, but a plateau of some duration, a flattening of the curve, followed by a steady descent. In the last few weeks, predictions and models of how COVID-19 will affect us moving forward have changed again. The expectation now is that combating this virus will not be like fighting our way through a singular surge, but more like crossing a mountain range, with a few or perhaps several peaks and valleys. Current projections are that the virus will not be conquered entirely in the immediate future. We'll be living life a bit differently for months to come, and perhaps longer. What does this mean for the safety of Shore team members, patients, and the communities we serve? It means that for the foreseeable future, we must plan on continuing many of the new protocols and policies that we've implemented with the guidance and support of the University of Maryland medical system. At the same time, we must find ways to resume providing certain types of care that have been either greatly reduced or suspended while we've been preparing for COVID-19. One step in that direction is that we have dramatically expanded on our use of telemedicine for a variety of our medical care services. Another is that we're working actively on enrolling our patients in My Portfolio, the online patient portal that provides patients with ample access to their medical records, appointments, test results, and to their providers. We are now looking ahead to how we can safely resume other services that are important to our patients and their families. A few of these issues now being examined are: how can we reopen our cardiac rehabilitation services provided in our 3 hospitals for hundreds of patients each week? How can we safely resume providing elective surgeries that will bring patients improved quality of life, such as greater mobility and relief from pain or other debilitating conditions? How can we restore to normal levels our various laboratory and radiology services that patients and their providers rely on for annual screenings, diagnosis, and scheduled follow-up testing? While making detailed plans to accomplish all of these objectives, we're factoring in safety measures and strategies to protect our patients and staff, including but not limited to social distancing and masking. We're also considering the impact on our medical providers, our nursing and allied health staff, and our support team members. As we begin our celebration of May as Healthcare Heroes Month, the safety and well-being of all Shore Regional Health team members remains incredibly important to me, our board, and the Shore Regional Health and UMS Incident Command teams. Fighting this virus has truly been a system effort, and for that, I am grateful. On behalf of our board and senior leaders, I share our profound gratitude to each and every member of our healthcare team, all of whom are working hard to continue providing excellent patient care under these incredibly challenging circumstances. Until next time, please stay safe.